So I'm going to ask each of our guests today from this panel to answer a basic question. They're going to tell us who they are and what their company or community does and some of its best services. And we're going to go around starting in historical order. So Frank Antwerpes will be the first. Okay. Yes?
Yeah, well, my name is Frank Antwerpes. I'm CEO of DocCheck.com. We have been creating a medical community for 14 years right now. I have 3 charts just to present you what we're doing. Actually, we are believing heavily in user-generated content, meaning everything from our community comes from doctors, nurses, and other medical professions. This is the DocCheck lexicon. It's a wiki-style lexicon where doctors can make entries, can gather knowledge. And so far we have around 31,000 entries there, so a lot of medical knowledge in there.
My name is Drees. I'm one of the founders of Coliquio. We are a German-based online physician network. We are a problem-solving oriented community of about 50,000 physicians at the moment. So what doctors basically do is they can pose questions, they can pose some cases they don't know the answer to and solve them collaboratively in a very short time. And that is basically the service that we provide to physicians at the moment. Here is one example of how such a problem solving might look. There is a case of a not to be clearly defined pain in one patient's leg, and the physicians come together and discuss it and find a valid solution most of the time in a very short way. We also build kind of info centers. I chose our eHack info center for showing this. So what basically happens here is a collaboration of physicians who get together all their knowledge and all their newly found news concerning eHack on one platform, and they can discuss it, they can rate it, they can rank it, and so they have over the time of where this eHack was very a hot topic. They collected lots of data and gathered lots of valid information to help each doctor to be up on that topic, and it was very successful.
All right, I'm Henry Gazay. I'm a founder of VoxMed, and yes, VoxMed is a global healthcare community. It's regrouping healthcare professionals from around the world. We've been active. We've launched February 28th this year, so it's fairly new. We currently have around 5,000 members from 43 countries. We're inviting members to join VoxMed, whether they are physicians, pharmacists, or nurses. And that's one of the particularities of our platform, is that we accept not only physicians but healthcare professionals as well. It's developed in 8 different languages. It's very social. You can see here that's actually my page on VoxMed a couple of days ago before coming to the conference. So we have a feed of information where members can participate, can share comments, like and like some of the feeds of information. We have different activities that are proposed to the members. The members are authenticated, so we make sure that we are talking to professionals, healthcare professionals who have a current license going on. The different activities that we propose, so you can see some of them. This is the what we call the landing page. That would be the page that you would see on the profile of the different people. So where you have the feed of activity, and then colleagues. You can connect with colleagues in the community. You can search in the database of VoxMed. We have an active database of around 2 million records that we can look into from more than 60 countries.
So Eugenol is part of Abecedon group that has been created like more than 10 years ago. So Abecedon is an open platform just informing practitioners of dentistry, it's Doctor of Dentistry community, on training. And when it was created, they decided to create a forum as well. The forum was inside the platform, and it didn't work. So they decided to put it out. So basically...
so the forum is no password?
It's outside the first platform, which is called Abecedon.
Mm-hmm, okay.
So we have like 7 brands. Eugenol is our blockbuster. It's gathering like 20,000 doctors of dentistry, only in French language. Very active. For a practitioner, when you ask a question on this forum, you will get an answer within like 10 minutes. So it's always chatting on this platform. We have different services that have been added, like throughout the years. The first is Canal Palatin, which is a YouTube-like platform. It's gathering on the web. Maybe on the other side we show it. This one. So we decided to gather on the web to aggregate all the video on dentistry and to let the brands and the practitioners upload their own video. We added as well another platform which called 10 Days. It's like 2 weeks ago. It's a group on like, so we're offering deals to our community. Now coming back to Eugenol way of functioning, it's open. It's completely open platform. Practitioners are just speaking on their pseudo and avatars. And the way we decided to open it is so that marketers or customer services can see what's on the platform and be called by the practitioners.
How many dentists use this platform?
20,000 users.
20,000 out of a total of 30,000, 33,000?
42.
42, so half of French dentists.
We guess half of them, but because it's open, I guess some don't subscribe. So
okay.
We are more than 80% of the community.
Right, and Martin, remind us, I think it's 40 some odd thousand?
With us it's approximately 50,000, yeah.
Growing since I last saw your slides. And Frank, can you remind me of the numbers in Germany and outside Germany with the microphone?
Well, DocCheck altogether has 750,000 users registered, but we only count to our core community all the users which regularly change, and that's around 40,000. So there's a lot of registered users, but as it's always on the internet, only a small number of users contribute actively, and so we reduce the community number to the level which is really...
Okay, so Tim has guessed why I asked them all the question, because I'm going to say to Tim, so in the UK, how many British doctors are using doctors.net?
Well, since the service was founded in 1998, 184,000 doctors have registered.
184,000, yes. And how many doctors are there in the UK?
Well, there are around about 160,000 working in a clinical post, and when we do a dedupe...
So who are those 24,000?
Well, the answer is that that 184,000 is the number of who've registered since DoctorsNet UK started. When we look at our database and say, well, who's actually...
Could you hold the microphone and speak a little bit slower?
When we look at our database to see who's actually licensed to practice, we have 158,000 members. And so that means that we've got some retired doctors, some doctors who've moved abroad. And so we can target the services very precisely to just the doctors who are licensed to practice.
Have any of the doctors become patients and then ask other doctors about themselves?
Well, that's a really interesting question, because if you look at the forum, quite a large proportion of the discussion is about themselves, is about their relatives, or maybe they have a friend who has a problem. They might be a radiologist, but they have a problem, a patient or who's got a psychiatric problem, and so they're able to use the forum to get an opinion from somebody else. Sure, well, you've heard that DoctorsNet UK started in 1998 with 184,000 members, and I'm just going to give you a glimpse of how you just heard that maybe one doctor in the UK wasn't very good at uploading a picture of themselves onto another website, but actually this online professional community is used as part of the daily routine and is affecting and improving patient care in the UK. If we go to the next slide, it's going to give you a glimpse of the look and feel of DoctorsNet UK. Thank you very much. And it's not just a forum. This is a closed community. We authenticate every doctor who joins DoctorsNet UK against the General Medical Council database, and they get access to a range of services. But we know that one of the things they really appreciate is the fact that this is a closed community. This isn't an open community, but this is closed to UK doctors. They're able, therefore, to have the sorts of discussions that you can only have as a professional with another professional. And you heard before about how we have to be very careful as professionals with how we engage with the wider social media. The heat map on the right is always very great to see during the day, because you can literally see the UK lighting up during the hours of the day as more and more people use the services. And what we find in a day is over 44,000 different doctors will use the services, and that equates to 25% of the total UK population, as you've just heard.
Maybe we'll take another comment or question. I saw there were other hands. Oh, right here from France, right up front.
Hi.
Franz Wiesbauer is a doctor from Vienna.
I have a question to the social media platforms. We've heard from a lot of people also yesterday, and that's also my personal experience, that it's quite hard to get a conversation going between doctors, to make doctors contribute. Can you share your experience? What do you do to encourage contribution of doctors?
Well, it seems to me that when you put up the case, they commented right away, but sure, go ahead.
Well, it takes a lot of time, is the first thing. But I think the most important thing for doctors in the UK, at least, is knowledge that the discussion... Is this on?
Hold it to... I don't know.
In the UK, it's working. In the UK, it was the fact that doctors could be reassured that discussion was closed, that there was a wall around them, that they could be reassured that what they wrote was only going to be seen by their fellow doctors, was the most important thing. And that remains one of the things that we have to protect very carefully. But of course, the reality is that it's only as secure as the people who use the network. And so we have to have very careful terms and conditions so that the people using the forum know that they would be breaching the terms and conditions if they took a comment in the network and posted it on Facebook, for example.
Henry, I see you'd like to say something about this?
Yes. Yeah, okay. Yeah, to Tim's point, I think that authentication is key, so that physicians are sure that they're among physicians and they can share freely among physicians. So there's a factor of trust there, is how trustful is the platform that I'm using, and how transparent are they in the way they promote this conversation among physicians. That's number one. So full transparency about the way the information is shared, number one. And number two, also as it relates to cases, and I just want to illustrate with a case that happened to us lately on a physician who inquired about having a patient suffering from myoclonic dystonia. That's a condition that I had never heard of. I don't know if you're aware of it, but that's a neurological condition that one of our physicians in Italy, said, well, I've got this patient suffering from myoclonic dystonia. I have no idea how to treat this patient. And that's certainly something that a physician wouldn't say in a public forum, but he was very happy to find other physicians in a private forum and closed forums.
Closed or not, I think that's not important. I think this is an issue of time. Doctors have not a lot of time twittering or harvesting their Facebook account or any other social media account. So really you have to give them a benefit. So only when you give them a hard benefit for their work, they will contribute to a community. And so what benefit do you give them? Well, actually, most of the benefit we can give them, they give themselves by teaching each other. So, because we are not in the role of giving them medical advice. We don't have an advisory board. So they are themselves on advisory board. So actually, the community is a benefit they have. So, and that's the greatest benefit they're looking for.
Yeah, I'd like the panel's opinion on what they believe to be long-term the most successful future business model, and in particular, I'm interested in the areas of pure play community versus community and content services, specialist communities versus communities that offer areas for all specialities. I'm interested in single market versus regional or global. And on top of all that, I'd like to know what is likely to be the best way to monetize the whole thing.
There's no one business model. There's a lot of different business models. Actually, when you have a community or when you have fostered a group of users, you have to offer some things where you can reimburse. So what we are doing is e-commerce. So we are offering doctors to buy their medical supplies in our shop, to buy e-books, do a lot of market research. We do some advertising. So actually, there's a lot of different business models, and altogether, well, they make it profitable. But there's not one model like Google Ads that finances all the service.
It would be too confidential if I ask you what's the average purchase per year per doctor? Or can you tell me?
For e-books or medical goods?
Overall, a doctor in DocCheck, how much is he spending in DocCheck each year?
Well, I can't tell you exactly because not every doctor is buying in our shop. But on average, the doctors which are registered as buyer in our shop are spending around 300 to 400 euro per year. Yeah.
I think that's really interesting because using a credit card online was for a long time a sign of maturity about new technology, and that they would go to a place that is free and then make a purchase, I think shows really a new level of appropriation of the internet by the doctors. Who else would like to comment on the business model? Yes?
I was very happy that in your keynote you brought up this Clue Train manifesto, because that is kind of the idea behind our business model. So we are doing some paid research as well, but on top of that, what we are trying to build is an environment where the pharmaceutical companies and the physicians can talk on eye level, where the pharmaceutical companies don't put in their usual advertising, where they don't do their regular push marketing techniques, but where they offer information, where they ask for opinions on that information, where they ask the physicians to comment it, to make suggestions how this content could be more valuable to the physicians, and where they can vote, for example, which new type of contents should there be that would be of value. So we try to get them talking, we try to get them understand, the pharmaceutical companies, that they are people as well, and that the people on the other side, the physicians, like to talk to people and not like to get bombarded via push marketing channels, and that is our approach to it. And if it's successful in the long run, I can't tell, but I hope so.
At the beginning, and because it was part of a profitable platform, mainly because of user-generated content, for 5 years there was no business model behind Eugenol. And the day we decided to put advertising, it was accepted by the community, so we were pleased with that. Now we are shifting to e-commerce with discounted deals. So we go on with advertising business model, but we know that maybe within 5 years it will be over, I guess. So we'll try to shift.
So we've touched on the surface only of all the important parts of physician communities, which is that they need to give and receive, which is that there's an important new avenue for the idea of participating with patients, which even if the physicians aren't asking for it, I'm sure that the patients will. We talked about business models and how to make them permanent, the issue of specialization and national communities and global communities. And I think that all of this is fascinating. And so now I'm just going to announce the break and let you go off and play that game. Thank you.